right, well, good morning, everybody. Thank you all for being here. So I think this is our fourth kind of opportunity to talk about the third year curriculum and some of the revisions that we're making. I'm really excited to talk to you all about that. And probably most importantly, kind of get any feedback, thoughts, questions that you might have. However, there's a more important item to talk about than the third year curriculum. What I want to know is, who is your favorite Christmas character? I will tell you mine.
Gold miser. The elf that wants to be a dentist.
All right, well, I'm going to tell you mine. Who's, right? My all-time favorite, I love Olaf. Full disclosure, I'm saying it in public. Anybody else like Olaf? It's okay if you don't. Do you all know who Olaf is? Okay, good. All right. Okay. All right. Now to the important stuff. Okay, let's talk about the clinical curriculum. So one of the questions that's come up is, why revise it? It seems it's okay, it's working. You get exposed to the different disciplines, but there are actually a couple of really important reasons. One, we can always be better, right? I mean, we're always looking. We want to make sure that we keep up with what's the best way to deliver clinical education to you, to help you develop your clinical reasoning skills, and to really learn how to take care of patients. So that's a big part of it. And what's really emerged, I'd say, over the last decade or so is that how we teach you, the different approaches that we use, the instructional methods, our assessment methods, really impact how you learn the material. And if we're really thoughtful and intentional about that, then by the time you graduate here, you are really going to feel confident and be competent as physicians. So obviously that's our goal. So we need to be strategic about that. Now, we have also, as you can imagine, we get a lot of feedback from all of you, from your classmates who've been, who've already graduated. We have national metrics that we use, our GQ. We have accreditation standards. A lot of different things, and then external consultants. And I just want to make a point that as we've gone through this curriculum redesign, we have had input from folks who are outside of UT, and this has been really, really important for us to kind of help make sure that we are on the right track and that we're really taking the best, most evidence-based, kind of innovative approach to how we, to how we teach you how to take care of patients in your third and fourth year. Okay, so what is new? Now, I don't know if you guys know, we actually have a website that's available that you can all look at to kind of keep up to date on what's going on, and there's actually a little link that's called Updates. So every time one of our steering committee meets or one of our work groups meet, we put little summaries, and then you can also read the meeting minutes and agendas if you've got nothing else to do. So what's really one of the things that we've changed, or I should say that we're adding, is that and we talked about this last time, is that we are really articulating very clear expectations for what competencies, what knowledge, what skills, behaviors we expect you to have mastered, right, by the end of your first year, second year, third year, and fourth year. So what we're calling this competency matrix is something that we've all been working very hard on, so that this way everybody will be on the same page. You will know what's expected of you, and our faculty will know what's expected of you. So this is going to be a critical communication tool so that nobody will need to ask, well, what should a third year student know? What do we expect this person to be able to do? So that's one of the changes that we've made as we've gone through this whole revision process. And as you can see, this is a draft. We will have probably the final version, which is not going to look that different from this. We'll have that in January. But this gives you an idea of one of the things that we've really worked on, is making sure that we are very clear and that you are very clear what we expect you to learn and when we expect you to learn it throughout your 4 years, and of course especially in the third and fourth year. So that's one thing. Assessment and evaluation. So as we have talked about, and as I'm sure you have all heard from your upperclassmen, that our assessment and evaluation paradigm in the third year has probably been one of our biggest challenges, because we've really been thinking about, and the feedback that we've received is that it seems very subjective, it doesn't really capture our clinical performance. And so we have really taken that to heart, and we've worked very, very hard. We have a whole work group that has looked just at how can we best capture your performance, your knowledge, your skills in the third year. So we've told you what we expect, but are we actually do we have an approach where we can actually very explicitly state to you, okay, yes, you've got your history taking skills down, you've got your physical exam skills down, but maybe differential diagnosis, clinical reasoning, you need to work on, and how do we give you that feedback? So I believe we have found an approach that is going to be much less subjective, more objective, that's going to be clear to all of you what we expect and clear to our faculty, because that's the other thing that we've heard. Do our faculty know what's expected of us? Do they know how to assess us? So this is just a part of what the entire evaluation will look like. And so what you see here, so for example, when we said, we have certain expectations when it comes to patient care. So we expect you to know how to take a history. And so we've broken that down. Said, okay, is your HPI organized? Do you have the pertinent positives and negatives? So we've made things very concrete for our preceptors. And then what we're asking them, and this is what's very different, is, for example, when they work with you, is your HPI organized? Is it organized all the time? Is it close to all the time? Is it maybe often half the time or never? And so that's the approach that we're going to use. So the knowledge, the skills, the behaviors that we expect of you are very, very clear. And we've got about 30 different components to this. And so what we're asking our preceptors to do, one second. What we're asking our preceptors to do is then to say, okay, when they've worked with you, whatever that time period has been, how often did they observe, were you able to get the complete HPI? And then we're going to take this, and then we're going to translate this into one of the components that will determine your final grade. Did you have a question? Let me come up there so I can hear you.
When it's talking about rarely, often, most of the time, all the time,
yes.
Is that starting, does that encompass your first day there?
That's a great question.
Accounting for growth, is it supposed to be by the end of your time there or by the beginning?
So the question is, I just want to make sure that I understand it. So the question that your classmate's asking, when we're looking at the frequency, right? So is that based on the 4 hours that somebody works with you, or is that based on the entire rotation? And so it's going to be based on the amount of time that a preceptor spends with you, which brings up a really important point. It means that you're going to get more. You're not just going to get one evaluation. And that's what's really important. I think that's been one of our challenges, is that our preceptors have been worried, well, if I don't give this student a certain number grade, then he or she won't do well. And so we've taken that part out of it. There's no scale here. There's no 1, 2, 3, 4. There's no scale. This is just about, are you competent? Do you have the skill? Do you have the knowledge that you need? And if so, is it all the time? Is it some of the time? Now, I'll tell you, one of the things that we're still working on is just how we define those middle categories. But I wanted to show this to you so that you know what approach that we're taking, okay, overall. And I think that this is, based on the folks with whom we've talked to, I think this is going to be a significant improvement in terms of really objectively and accurately capturing your performance, so that it's not just, this student was nice to work with, because that's what we're trying to get away from. So that's one thing. And the other change that we are working on is that we've eliminated, just one second. We have eliminated the whole idea that your clinical performance evaluation is a certain chunk of your grade, that your how you perform on the subject exam for each discipline is a certain chunk of your grade. We're not doing that anymore. What we're saying is that there are 3 components to assessing your overall performance. One is how you perform clinically, right, based on that new assessment form. One is your knowledge based on how you perform on the subject exam. And then the other is something that we call departmental points or educational points. And these are more specialty specific, like, for example, how you do on the OSCE. Do you participate? Do you attend all the didactics? So those kinds of important things. Those are 3 separate components of your overall performance. And with that, we are then going to figure out, okay, so if we look at how your clinical competency evaluation, so what would be looking at the frequency with which you exhibit certain behaviors, certain skills, what would be considered exceptional. If you guys remember the last time that we met, what we said is that we're really trying very hard to distinguish exceptional from what we would expect, where everybody should be. And if you're above where everybody should be, then that makes you exceptional or honors. And then we're still trying to figure out what that middle, if there's going to be that middle grade. I saw, yes?
Can you go back to your previous slide real quick?
Yeah.
I had a follow-up question to his question.
Yes.
Actually, this is so there's no scales or numerical rating, and I think that's a really positive step forward. However, I'm having a hard time seeing the difference between 5 through 1 and then always through not observed, because what I've heard from upperclassmen is that there could be someone there that's gunning for a certain specialty and someone there who's just there, and they get the same score, saying like maybe a 3 out of 5. And so I was wondering what kind of things do the preceptors have to go through in terms of like training or like what's expected of them to make sure that often isn't the new 3.
So let me just make sure I understand your question. So I think what your colleague asked is, so how is this really going to address the issue of preceptors just going down and saying you're an always, or saying that you're a nearly always or an often, whatever we end up using. And what we are doing between actually now and May 2nd, when you guys all start, is there's a module that's being made that is going to be delivered to all of our preceptors, and it's going to show them exactly what these what we're expecting with these evaluations, articulating it, making it very clear what the purpose of these frequency categories is to address just what you're talking about. And when they see this evaluation form, what we're also going to have here highlighted is what we would, what the profile would mean meets expectations. So it's very possible. For example, with an organized HPI, if in order to get an honors with the HPI, this is something you guys, have been talking about now for 2 years. You're going to have your ICSI that's going to test your ability. So really, you should probably always or nearly always be able to get an HPI. It might be different when we get down to some of the more nuanced skills. So it will be very hard for someone to just check always, because that's going to alert clerkship directors, because we're going to be monitoring this. We're going to be monitoring just what you're talking about, because that's what we're trying to eliminate. We want people to really think, okay, was this student's HPI organized? And if so, okay, how often did that occur? Does that make sense? Because that's exactly what we're trying to eliminate, just what you described.
And then one more question was that, would you like us to, is there a spot to like self-report hours for how much time we interact with the residents or the physicians? Because I don't know what is in place right now, but I figured it might be more objective if we like self-report who we spend time with.
So the question is, how will we know how often and how much time you spend with a particular preceptor, right? Whether it's a half a day, whether it's a whole week. And there is a box at the top of these forms where you check just that, and where your preceptor checks just that. You have an opportunity before any kind of grade determination is made to review the evaluations you've received in the context of the amount of time that you spent with a preceptor. So let's say that preceptor checked the 1 day box, and let's say that no, you really spent a week. So you can question that, and then the director will go back to your preceptor and ask, so why is there a disparity? Yes?
With that, will there be any indication of if we, let's say we were with them for 2 days, whether it was the beginning of the clerkship or the end? Because at the beginning, we're probably towards the lower end, and hopefully by the end we're at the higher.
So the question that's being asked, this is a great question, is there a way to build into this assessment system just the natural progression that we would expect of your skills compared to the beginning of the 3rd year and the end of the 3rd year? And I will tell you, what you have asked is such a good question, because this is something that has been looked at in the clinical assessment literature probably for the last at least 30 years. And this is the challenge. So we either are or we're not going to. And what we have decided is that we're not going to build that in, because what it would mean is that we would actually then say, okay, so is it the first half of the year where are we saying first half of the year, the second half of the year, or should we divide it into quarters? Should we divide it, and that's the biggest challenge, is knowing how to do that fairly. So at what point, where do we put those lines, right? Is it thirds? So should we say, let's look at your performance in the first third of the year, the second third, the last third? Quarters. And I'll get to you in just a second. And that, I think, has been the biggest challenge if you look at the literature. And so it is a given, we know, and your preceptors will know that, yes, you may not, when it comes to some of the more nuanced skills, that, yeah, you may not be in always. But we've taken that into consideration when we define what is going to be exceptional. So we're not saying, what I want to make clear is that we are not saying that in order to get honors, you have to be always in everything. That is not at all what this is going to be. There are going to be some categories where often may be enough. So that's how we're going to account for that. It's a great question, and if you have any suggestions or solutions, love to hear them, because this is something that we've all grappled with, institutionally and nationally.
So I guess kind of what you were saying is that you're not going to do it for like the beginning of third year versus end of third
Correct.
year?
This is just what we expect. These are the expectations.
Are you going to do it within the clerkship, though? So like
Within the
the
clerkship.
first day of the clerkship versus the last day of that said clerk?
Yes, so that's a good question. So the question is, okay, we obviously can't make those adjustments throughout the year, but can we say, this is where you started at the beginning, this is where you are at the end, and that's exactly what this will capture. That's exactly what we're trying to capture, because the point, and I can't emphasize this enough, the point that your colleague is bringing up is that, you know what, what's really most important, it's not that you're always, the best all 100% of the time, but it's where you started and where you end up. It's that delta for you as an individual. And that's what this system, that's what this approach is meant to capture, because everybody comes in at different levels. Totally get that. Yes. And that said, there are certain behaviors that the expectation is you will be always. For example, professionalism, right? That's an expectation where no matter, that everybody exhibits professionalism all the time. That's a non-negotiable. But some of these other knowledge, these skills, we realize that there is a developmental progression, and that's what we've tried to capture here. So this is what we're working on right now. So again, we're getting rid of the 50, 30, 20, and then one of the challenges that and one of the things we're grappling with and talking about is just how many levels, how many categories of grade should there be. So right now we have honors, high pass, pass, and fail. So should we just have honors and pass? Should we have honors, high pass, pass? And that is we're spending a lot of time looking at that. So that is a to be determined. So I will have more information about that probably when we get together in January. So any questions about that? Yeah, I saw a hand.
So for the first slide, you were given a standard way to organize an HPI, but what if your preceptor organizes their HPI differently?
So that's a great question. I'll have to think about that. That's a great question. And really, when you think about it, an HPI should always have certain elements. You know what I mean? So it's, if you're talking about abdominal pain, there's always certain qualities and components of abdominal pain that you should have, no matter whether you're a second-year student or you're an attending who's been out in practice for 10 years. And, to be honest with you, you bring up a really good point, and this is the expectations, and really, and not just about, okay, you should be able to do a history, but what does that mean? And what that reminds me is that we've got to make sure that we are very clear in communicating what you've been taught and what we expect you to know. And I'll be very honest, sometimes there is a disconnect. There really is. That's a really good question. Yes?
What's the thought process behind eliminating the high pass grade?
Yeah, so thank you for asking that. So the question is, why would we even think about eliminating the high pass grade? So if you look at some of the data and publications on assessment, what has clearly been shown is that middle tier, whatever you want to call it, whether you call it a B, whether you call it a high pass, really it doesn't change how program directors really decide whether or not somebody's going to get an interview for their residency, even in the competitive specialties. So we know that. I mean, there's some really good studies that have asked program directors this question. Now, the challenge, I think, is, so does that apply? Can we extrapolate that for our institution? So University of Toledo may not be as nationally known as other institutions. And so would we be better served for all of you to have that additional grading tier? Since a lot of folks don't know about University of Toledo, and would that help? And I think that's really kind of the conversation and the thought process that we're having. So if you look from a strictly evidence-based perspective, that middle grade doesn't make a difference. But would it make a difference?
But it is the standard still, right? Pretty much across the league.
So interestingly enough, there is data on this. And when you look in 2020, 2021, out of the 152 LCME accredited schools in the United States, 85 of them are using some kind of 4-tiered grading. There are a smaller proportion that are either doing just pass-fail or high pass-fail. Yes? So this is a discussion that we are very actively having right now. And I'll be honest with you, at the end of the day, we want to make sure that we are going to do whatever decision we make that's going to put you all in the best light and obviously make you the strongest candidates possible for any residency that you're applying to. And that's really that's our thought process, if that helps. Any other questions about that? Yep.
Yeah, this is kind of separate, but going back to, I guess, a little bit with how we're graded, are you guys tracking, like, as this goes and it's implemented, certain trends? So, like, if there was one attending who's always, tougher, or one attending who's always getting, rated outstanding, regardless of how you actually do, is that being, like, monitored or anything?
So the question is, for those preceptors who tend to just go down the line, is there any way that we're going to be able to identify that? And the answer is yes, that is something that we are going to be very actively looking at within each discipline and then across all disciplines, absolutely. And especially whenever you introduce something new, that the initial kind of, CQI, if you will, or that initial kind of following how things go, your feedback's going to be important at the end of every block. We're going to be asking all of you, so, what did you think? Not just about the assessment, but about the clerkship structure, things like that. So we're going to try to get as many perspectives as possible. So the answer is yes, yes, and yes. Okay. The other thing that I wanted to make sure that we touched upon today, because this is quickly coming up, is your track registration. And I know we've talked about a little bit about what the structure of third year is going to look like. So as you all know, we've really thought about how you take your clerkships. Our goal has been to make this less siloed and disconnected and to try to have some thematic connections between clerkships. So when you look at your tracks, you're going to see that family medicine and psychiatry are always together, OB and Peds are always together, internal medicine and neurology are always together, and surgery and your elective are always together. And we have introduced a new course that you'll be taking after your family medicine and psychiatry dyad and after your OBGYN Peds dyad that's called Integration Intercession. And it's explicit, and it's really explicitly been designed to to help you think about, from a transdisciplinary, multidisciplinary lens, how do different disciplines manage different conditions? And we're using a self-directed learning framework, similar, for example, I think to what you guys have done with nutrition, that same kind of approach. So that's one thing that's different. So when you go for your tracks, you guys are going to see 24 different choices. And this is just an example of what it's going to look like. So as we've talked about before, what I want to make sure that you've all had a chance to think about before, I think it's the end of January when you're probably going to register for your tracks, is that when you think about surgery and medicine, so surgery and the elective are always together, internal medicine and neurology are always together, but we've got a flexible track option for both of those. So for example, with surgery, you can either do surgery first, then your elective, you can do your elective first, then surgery, or you can do the first half of surgery, 4 weeks, take your elective, and then finish the last 4 weeks of surgery. And the reason that we've included this option is that we realize that everybody absorbs material, learns material at a different rate. And so for those of you who would benefit from a little extra time to think about material, So you do your first 4 weeks of surgery, take your elective, and then go back to surgery. There's actually, from a learning perspective, if you're thinking about how you best retain information that you've learned, not just store it in your short-term memory, that when you have to go back and after a period of time has gone by to rethink and to revisit what you've learned, that's going to make for much longer-term retention and understanding of the material. So that's why we have this flexible track. So that, same thing with internal medicine and neurology. You can do internal medicine for the 8.5 weeks, then neurology, you can do neurology, internal medicine, or you can do 4 weeks of internal medicine, your neurology rotation, and then finish with internal medicine. So that it'll kind of help you can make those connections and think about the material over a longer period of time. Whichever option you choose, your subject exams will always be at the end of the block. So if you do surgery first and then your elective, you'll take your subject exam at the end of surgery. If you split it, you will still take your subject exam at the last block. So that'll be after the 12 weeks. Any questions about that? So these are 6 of the tracks that you'll see when you have to make that choice. Any thoughts on that? Okay.
How will it look in terms of choosing tracks? Will it be a sort of a first come, first serve rush to sign up, or something not quite like that?
That is a great question. I know that the Office of Student Affairs is working on just that issue. What I do know is from the past, if the past does predict the future, that yes, it will be first come, first serve. We're not using, to my knowledge, we don't have a lottery system. I know that's one of the things that's been talked about. And this is something that's, that I know has come up year after year. And I think you guys are meeting with Student Affairs at the end of January during one of the, continue one second, during, I think after one of the last days in repro. So you'll have an opportunity. They'll give you more information about that. But it's a great question, because obviously we want to keep it fair, and it shouldn't be based on, how fast your internet is. I totally get that. Yeah, I think I saw a hand way back there.
So this is a question, I just don't know how it works. But you mentioned these exams after the blocks, right? So in third year, when we're doing these rotations, are there this material we need to look over, and then we'll be tested on it after? I just don't know how it works, and I figured I'd ask you.
So when you say how it works, do you mean how the registration works or how the split clerkships would look?
No, it's more like you have an exam at the end of it, right? Out of the block, correct? Like a shelf exam?
Yes.
Okay, so who's providing us the material that we need to know to take that exam?
So you're asking in general, how do you prepare for a subject exam in the third year?
Yeah.
Okay. So in general, what you will get a syllabus for each of our disciplines that will give you the list of resources. So first of all, they all have learning objectives. And the process is not that different than what you're doing now in your preclinical curriculum. Everything, any activity, anything that you have is directly connected to those learning objectives, because that's what we are saying it's really important for you to learn. The resources that you should be using will be listed in the syllabus. Because I think what you're alluding to is, how do you study for an internal medicine, subject exam? Because the field is so broad. How do you study for a pediatric subject exam? So you will get those resources so that you know. What's really cool about third year, and when you really start taking care of patients, is that you're going to find that you're going to have such a deeper understanding of all the things you've been learning about for the last 18 months, because you're seeing patients. You're actually seeing that patient with abdominal pain, or you're seeing that pregnant patient, whatever you're rotating in, and it really helps to solidify the concept. So a lot of this is going to be experiential, but there will be specific resources that will be recommended for you to use. An example is it's the same reason that we introduced the Beckman and Lynn textbook into repro, because that is exactly what you're going to be using when you do your OBGYN clerkship. We want you to have that connection and continuity. Oh yeah, I've read this before. I've read the menstrual cycle here before, and it'll be more of a review than a preview. I think I saw your hand.
So when we're registering, how do electives work? We just register with a track and that's
Yes.
an elective, and then we go back in and pick our elective?
Yeah, so the question is for when you choose a track and you have an elective, So you will not be choosing the elective. You are just choosing the track, and then at a later date, you will choose the elective.
So do we know that, like, if there's an elective we want to take, do we just hope that it's offered during the block, or are they all offered, or?
So the electives, definitely there is some seasonality, if you will, semester breakdown on the electives. And if there's a specific, so let's say maybe there's a specific elective that you want, and you're thinking your elective is going to be more in the spring, what you can do is reach out to the coordinators and just ask in general, is this elective, is this M3 elective available all the time, or is it just one time of the year? Because if you know there's a certain elective you want to take and you want to take it at a certain time, you can get that information ahead of time.
Is there ever issues with people not being able to get into the electives they want because of like demand, stuff like that?
So the question is, for the third year electives, are there situations where a student may want a certain elective and not be able to get it? Yes. Yes. I'm just going to go from left to right.
Is the elective specifically for surgery, or can you, like, if you don't get the one that you want, can you take it for
You can take any elective that you want.
Okay.
Any elective that you want. We are pairing it with surgery during that block, but you can take any elective that you want to take. Yes.
How does AHEC fit into all of this?
Oh, great question. So, as you guys know, the question is, how does AHEC fit into all this? And as you all know, you have to spend 8 weeks in AHEC. It's sometime during your third and fourth year. So within each discipline, there is an AHEC option. Whether it's 3 weeks, 4 weeks, however many weeks. So that you will find, that will be discipline specific in terms of what the options are. And anybody who knows, like for example, let's say you're looking at pediatrics and you know that there's an AHEC in a certain part of Ohio, maybe you're from there, you want to be there, you want to be in a certain region, you can let the coordinator know ahead of time that you want to do an AHEC in a certain area. And the coordinator, your discipline coordinator, will contact the AHEC coordinator and really see if we can match you up, especially if there's a specific region that you want to be in.
What about away rotations? Is that something you can do, like?
Not in the third year. So, not in the third year.
Oh, not.
Yeah, the question is, no, there are no wave rotations in the third year, for the most part. If you have a specific circumstance that you wanted to talk about, obviously, we can discuss it. Yep.
Yeah, so I just had 2 quick questions. So first, the 2 intersessions, so like in the psych and family med diet and then pizza noting, I think you said those are 3 days, and I was just wondering, will we have scheduled activities during those days, or is that just like on our own time?
Yeah, it's a great question. So those intersessions that you see, those 3 days have scheduled activities, scheduled in-person activities. Now, what's really important is that those intersessions are separate from your clerkships. It's not they are evaluated and assessed separately. They have different activities. So, for example, we're using the intersessions as the opportunity to kind of have an activity that's directed at that transdisciplinary thinking about clinical conditions. There are also going to be workshops on health equity, value-based care, ethics, professional identity. We're going to kind of extend that thread that was introduced with your learning pods. Career exploration. We're going to have folks from student affairs are going to have a dedicated activity. So some of the things that are really important that we want to make sure we have longitudinal threads for your entire 4 years. So yes.
And then I was just curious, if, of course not planning anything, but if there's any like family emergency or personal things, do those usually get taken up at the school, or is that something that you do in your like individual rotation?
I did not completely hear your question.
Oh, sorry. Yeah, so I was just wondering for any like things that come up during third year, like a death in the family or things like that,
yeah.
are those just like things that we take care of like within the rotation, or is that?
Yeah, so
because I know it'll be a busy time.
So I think the question is, for those, if you need time away for whatever reason, especially if it's emergent, we figure it out. Okay. Yes, you let your coordinator know, let your director know, and always, that's never an issue. Okay. You just have to let people know, that's all. Yep, absolutely, because things do come up, yes.
Relating to the AHEC stuff, I know that we're required to do, I think at least
8 weeks.
Okay. Are we able to do more than that if we would choose to?
Sure. Absolutely. Oh, absolutely. Yes. Yes, yes, and yes.
Just to clarify on that, is that 8 weeks does that span to, like, would there ever be a reason that would span 2 different rotations, or is that all always within one isolated?
Oh, it's across the third and fourth year. Yeah, it's not within one rotation. So you might do 2 weeks in one discipline, you might do 2 weeks in another, and then 4 weeks in another. And again, the AHEC requirement is across You have the whole third and fourth year, that total, yeah.
I think I asked this last time, but say you want to do an elective that requires surgery as a prerequisite, would that first, and you did the split, would that first 4 weeks of surgery suffice as a prerequisite?
So the question is, if there's an elective, if there's a surgical elective that has a prerequisite for surgery, and you've done your first 4 weeks, would that count? And the answer is yes. That will count for the surgery prerequisite, yes. Yes?
We're interested in all the different electives that are available. Is there some website we can look at where we can find a list?
As a matter of fact, so the question is, if you wanted to know all the third-year electives that are available, is there a website? And there actually is. If you go to our overall curriculum website and then we break it down by foundational sciences and clinical sciences, there's a link that says third-year electives. So yes, and all the important dates and everything that you need to know. Yes? What else? These are good questions. What else? Yes?
So I think we kind of talked about at one point, like for IM and surgery, I think you said it'll be broken up into like 2-week mini rotations with those?
So that's an interesting way of looking at it. So yes, the question is with internal medicine and surgery, how do they split your 8 weeks? And they're going to do it in 2-week blocks.
2-week blocks,
Yes,
okay.
yes.
Will any of the others do that? So for instance, like psych, like I've heard that there are some that are outpatient, some that are inpatient. Like, what if you want both experiences? Like,
So the question is with the disciplines that have, you have different contexts, inpatient, outpatient, will you have an opportunity, will the discipline be split so that you can do both? And the answer is yes. And it's one of the reasons that we redesigned the third year. So for example, with psychiatry is a great example actually. With the extension to 6 weeks, this is going to allow every student to have an inpatient experience and every student to have the most outpatient experience, which is the majority of psychiatry, but everybody will get to rotate in both contexts. That's exactly right. What else? You guys have good questions. Oh, so sorry, yes.
I guess kind of bridging off of that, so is there kind of like flexibility within the rotation? So say I'm on OB, I was really interested in MFM, could they kind of direct me more towards it?
Yes, that is like the best specialty in the world. Anyway, go ahead.
Regardless, I am, if I was like interested in cardiology, like do they kind of like tailor that to you a little bit, or do you just kind of get lucky?
Yeah, that's a great question. I think, so the question is, if you have a specific component of a specialty that you're really interested in, so internal medicine is a great example. Let's say you really love cardiology and you want to have an opportunity to be exposed to that. If it's part of the rotation, all students will have the opportunity. So there are some of the subspecialties that are included in each of the disciplines, and the question you asked about OBGYN is another good example. So let's say you've known from day one that you want to be a maternal fetal medicine specialist. That is just part of the rotation. Everybody has an opportunity to do that. And if you want to go into MFM, that's even better. What else? Yes?
If you're interested in primary care just in general, how would you approach picking a track since like peds and IM and things that are kind of, spread out?
So so the question is, if you know that you're interested in a specific specialty, and I think the example that you gave is primary care, is there one track that is better than the other for the third year? And it's such a good question. I can tell you, just strictly looking at this from a scientific standpoint, people have asked this question, and it turns out in the third year, truly, and I know this is hard to believe, the order of your disciplines really does not matter. Does not matter. Now, from just a strictly personal anecdotal standpoint, if you just love primary care and you can't wait to do it, so then, probably the track you might be looking at is the one with family medicine, psychiatry, internal medicine, and neurology first, because you love it. You know you love it and you want to do it. That's great, But I can tell you guys, and I know you don't believe this, but you'll see that it just does not matter the order that you do it. If you love something, sure, do it first. And I can tell you the contrary point is, well, so if I know that I want to go into pediatrics, shouldn't I wait till the end of the year to take it? Because I'm probably going to do a little better, right? I mean, you've had the whole year to practice. It's true. You're right. Absolutely right. But at the end of the year, or I'm sorry, at the end of the day, rotation order really doesn't matter. I can tell you that, I knew from the day I was born that I was going to go into OBGYN. I wanted to do it first in the third year. I did it first in my third year. I was a pretty klutzy third year student in the beginning, and clearly it doesn't matter. So what I'm saying is, don't perseverate too much on track order. Yeah?
Forgive me if you answered this already, but I know you said tracks are first come, first serve. Does the same apply to the actual electives?
Wait, you said the tracks are first come, first serve, but what's the other question?
Are the electives as well? Like when it's time to sign up for electives, like is that a similar process?
So for the third year, we have actually been discussing just that question. How are we going to make the registration for the electives as fair and equitable as possible? Right now, it is first come, first serve. And that's probably what we're going to continue. But the caveat and the asterisk is that we're trying to figure out if there's some way that we can take out that internet speed factor. So, for example, we've been working with the library folks to figure out for the students who may not have great broadband, how can you, if you wanted to be on campus, are there ways that we can make sure that you will have access to as fast a computer, that everybody has the same access. So that has really been a huge conversation. And it's kind of something that, to me, is a really big deal, because that access equity issue is really, really important. So for now, it's first come, first serve, but we're trying to figure out how to make it fair for everybody.
With all of us taking electives at different times on the different tracks, is it that big of a scramble to get the elective you want?
So the question is, since you're obviously all not, all 180 of you are not trying to get the same elective for the same month, is it that much of a scramble? And probably the only specialty where there has been a little bit of competition, if you will, is emergency medicine. So a lot of students really love taking emergency medicine in the third year for a couple of reasons. One, it's because it's what you want to match into, and because it is it's one of our requirements for graduation. So you can either take it in your third year, or you can take a 2-week course in your fourth year, but emergency medicine is critical. So that's probably the one that may be the most competitive to get.
Is there a way to stratify people that are interested in emergency medicine and want to try it third year before we start applying to residency and stuff, or versus the people that just want to take it because it's required and they want to get it over with?
So you have asked another one of those $64 million questions. Is there, and it's funny, we were just having this discussion today. So as we think about registering for your electives, and this is whether we're talking about you as third year students or fourth year, how can we make the system fair, but also add that other component? So what if this is what somebody really wants to do? How do we take that into consideration? And I'm telling you, that is really exactly what we're discussing. Do we just say, look, it's first come, first serve, fair is fair, whoever signs up first, or is there some other way to modify it, but so that it's still fair, so that it's not subject to the bias of someone who's making that decision? And I'm telling you, this is really something that we're trying to figure out. And if anybody has any suggestions on how we can do this, I'm very, very open, because this is exactly the discussion that we're having. More for the fourth year, but certainly for the third year as well.
Could you possibly do the reverse order for choosing your elective, so then you can kind of decide if the schedule is more important, or having a certain elective is more important, then I can determine you sign up really early for one or sign up late, that way you're able to go first for the elective. Do you know what I'm trying to say?
So are you saying, is the question...
could you do so you have first come, first serve for the tracks, and then have the sign up for the elective be the reverse order of that? So you get first come, first serve, but then...
Yeah, no, I do. So making it more, so let's say you don't get the track that you want, but do you get preference for your elective? That's actually an interesting suggestion. No, we have not talked about that, but that's actually an interesting suggestion. To be thought about.
So this is an MSc thing also for you and for also the class. Is something we talked about with Dr. Mattis. MSc is planning on putting out a spreadsheet for people to put down what track they think they want to try to sign up for, as well as electives. just so that people don't get super blindsided on the day, and they may know, like, okay, this track is like really in demand, or this is something that like not a lot of people are going for, or like, okay, like, this, a lot of people want this, so maybe this could be my backup. So we'll probably put that out sometime over break, but is that something that you would want?
Absolutely. Please, oh, that would be great. That would actually be super helpful. Yes, 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 yes.
Okay, yeah, so
Yeah,
whenever
I like that.
I'll do something about that.
And if you guys, as you're looking at the 24 tracks, if you do have any questions, please don't hesitate to shoot them over in an email. I will be checking email throughout the month of December because this is so important, and I know this is such a source of stress for everybody. And the goal is to make it as least stressful as possible.
So even if we can't register for your elective first and then register for a track that fits it, could we do something where you rank your electives and then, or we get a sheet with like, this is what the seasonality of this elective is, this is the seasonality of this elective, so that we can have that for when we're choosing a track?
Oh, I see. So just to know, are there certain electives that are only available at a certain time of the year?
Like just
Yes.
a sheet that you guys send out.
So in addition, so if you don't get your first track or second, if you don't get your first three choices,
You don't have to worry about
to at least know that you can get your elective.
Yes.
Yes, we could do that. Yes. These are great suggestions. Yes.
I had a question about the AHEC. AHEC, so you said that we have to complete that 8 weeks over the course of third and fourth year. Is that something where that's like, so say we do like psych, for example, is that something like we have to do all of our psych rotation has to be AHEC, or it can be like 2 weeks AHEC and then the rest of it at Slate City Hospital?
So the question is, when you are assigned to, if you're assigned to an AHEC for any specific rotation, is it the entire rotation? And no, I can't think of, unless you wanted that. Unless you wanted that, no.
In terms of like fourth year after this, like how long do we have between the end of third year and like to fill in other electives for like specialties that don't fall under the clerkships that you want to like see if they're a good fit for you or not? Like how long do you have basically before you apply to residency?
Oh, okay. So the question is, if you don't get to do the elective and you're contemplating two specialties, how long do you have to make your decision? And the final application for residency is not due until the end of September. So there are some students who will dual apply when they're, for many different reasons, but one of the reasons certainly can be because you're not sure. But the goal is you will have between the beginning of May and really the beginning of September to figure that out. And this is a situation where if you really, let's say you're deciding between, some people are trying to decide between OB and PEDS, let's say. So if you really, maybe even you did an elective and it didn't help, that's when you want to reach out to the coordinator and to the clerkship director and let them know. It's like, hey, this is what I'm trying to figure out. What are the options in terms of scheduling? Because we want to make sure that everybody gets to, does what they need to do to make their career decisions. Yes?
Has there been thought about increasing the length of the step 2 dedicated time, which would increase, significance of step 2?
So the question is, has there been any thought to extending the 2-week time, which is actually a 3-week time period for step 2 prep? And the answer is yes, there has. It is unlikely that we are going to be able to do that at least for the next year. And that's because we already have timelines in place for the new first-year students who are coming in, which impacts the second year, which impacts the third year. But yes, there have been discussions about that because it's clear with step 1 going to pass-fail. We know this is not rocket science that there's obviously going to be emphasis on step 2, even though we wish there weren't. But yes, there will be. Yes.
What's the normal amount of time left that people normally take for step 2 dedicated currently?
How much time is actually dedicated? So there's 2 weeks on the schedule, but there's the week before that is a break. It's your it's spring break. So 2 weeks that's on the schedule plus that week of spring break if you choose to use it. So right now it's 3. Did I see other? Yeah.
How important is it, let's say specifically for like anesthesiology, how important is it that you do the elective before you apply, given like especially our class with COVID was told to not reach out to find like shadowing opportunities? So if you're unable to do an elective that you want to go into that specialty, how important is it, or how detrimental would it be to not do an elective?
So you're saying if you know, so the question is if you know what specialty you want to do, and let's say it's anesthesiology. Yeah, but you're not able to get an M3 elective in that specialty, how important is it to do a rotation in that specialty?
How detrimental would it be, like let's say if you want to do anesthesiology,
I
you
see.
weren't able to do it in time to apply,
Yeah.
how detrimental would that be?
So it's not so much detrimental. I think what the question that you're asking, it's probably beneficial because you get to know some of the attendings and people get to know you. So it's one of those situations where it would definitely be helpful, but it's not hurtful because you're going to build your 4th year schedule so that you do you do an elective anesthesiology. You're probably going to do a surgical AI, something like that.
Not like a red flag on an
Oh, no. That's what you're. So the question is not doing an M3 elective in your chosen specialty a red flag or not at all? Not at all. Nope. Not even looked at. Not even thought about. Okay, I know we're getting close to noon. Any other questions? All right, you guys. Well, I'm really glad to see so many people here, and thank you so much for all the questions. If you think of anything, and if you have any thoughts, like I said, on track registration, elective registration, we really are trying to figure this out. So any suggestions? I love the suggestion about the, if you don't get your first 3 choices for a track, then you get your choice for an elective. That's a really good suggestion. Okay. All right, everybody. Enjoy the rest of the week and have a wonderful holiday break.